Welcome to my podcast. Firstly, I will be discussing the different type of communication, particularly regarding to the role of a care home manager in a nursing home, as they have many duties according to the World Health Organization. Intercollaboration is essential in providing patients, their family, carer, and all stakeholders the care and quality of which they deserve. Despite recent research showing a need for improvement of interprofessional collaboration, which will be discussed later in this podcast. What is communication in interprofessional collaboration? Can describe the sharing of information by means of verbal, writing, or other medium among members of different health professionals to influence patient care positively. There are four types of communication discussing two. The first, orientation, which allows the carer to warm up and make things comfortable between the team. They loosen things up between interprofessional communication to ensure successful discussion making and making decisions easier. The care home manager had a responsibility to ensure all team members are participating as a team to ensure meeting the best quality of care, such as arranging meeting. The second form of communication that is important, conflict, which is expression of opinion that can resolve of issues in communication. If not handled well, this can make a big impact and would need to be addressed in a mature way, and it will be resolved through effective discussion. Poor communication result in a medication error, care instruction can be misunderstood, and decrease morale among healthcare providers. Addressing these challenges is essential in enhancing patient safety, prevent them from high risk of consequent overall improve care quality in nursing home. Social care managers have a leadership role in the provision of the high quality care and support service. Managers are expected to lead person-centered, ethical, and inclusive service, supporting and promoting individual interpersonal communication skills, influence the quality and decision made as well as the level of the patient motivation to follow treatment protocol and achieve desired clinical outcome. What importance of communication? Interprofessional collaboration. There are approximately 418,000 people living in UK care home in population have complex health care needs and high level of facility, dementia, and multiple of people in the care home workforce is responsible for the day-to-day care of the resident and play a key role in the quality of care provided to this vulnerable population. Residents also rely on general NHS medical and community health service to meet their medication needs and reports have shown that residents experience something poor access to a range of quality health service. To preventable of failure of care and unplanned hospital admission from care home can be report resolving in the home being regarding to a drain of limited resource, making unwarranted of demanding on the healthcare system. Effective interprofessional collaboration and team working is critically important in delivering high-quality patient care and for successful integration of service. However, there is a lack of understanding between sectors about how things should work together effectively across organizations. There are boundaries to meet the needs of residents. Reduction in a hospital admission have been reported when health and social care work effectively together. Yes, other evolution is have shown in limit result. Successful partnership need to be underpinned by strong of interprofessional relationship and independent on the local contact of the service regularly. Now I will discuss the manager role in the care home. In the environment of the care home, the home manager play major role in this sector, and there is responsibility therefore providing information, advice, and support to the resident and family and staff, monitor the business performance in the quality of care, agree and contract the budget, and finding funding for who have lack of funding or who in the need, helping residents to attend to access to the local service, develop policy, keep private information confidential to ensure the quality of service provider meet the national care standard. Direct communication through the personal interactive between professional, between home manager and nursing, external and internal. There are many ways of communication, and such as face-to-face meeting or telephone call and email, and get the discussion on the idea. Manager communicate with nurses dealing with emergency when it occurs. In the serious emergency, call 999. And for the patient that's stable but need attention, nurse will call 111. And they had to call GP if the patient not in the high risk and document it to the communicate with home manager. The barrier of communication between the nurse and the carer can be occur if they have clash personality, and they not get along with each other. It can difficult to moving along when it comes to term to support the patient, and this is why interprofessional collaboration and communication is so important. Two things to take from this podcast is all positive and negative. Communication is essential to a collaborative care plan that provides patients with the best care and well as ensuring that everyone is treated in an ethical manner. When discussing interprofessional collaboration, always consider all stakeholders at the communication between the example, home manager and people family can prevent misunderstanding. Thank you.